A small town in eastern Ontario has a big problem. Hawkesbury is now home to the province's worst nursing home outbreak. 3 people have died at this facility. A third of the residents have COVID-19, so do nearly a quarter of the staff, totaling 78 cases.
If family members are nervous or they're anxious.
The home has been calling for help since the beginning of the month. Now the Red Cross and paramedics are there.
We're working hard, the staff is there, and everybody's doing double shift.
In the last few days, cases at long-term care homes have spiked dramatically.
I'm afraid that we are going to see the catastrophic loss of life that we saw in the spring.
Dr. Nathan Stahl says to avoid that, staffing levels must increase and community spread decrease. He hopes today's record-breaking number will help.
Reaching a threshold like this may actually motivate decision makers or policy makers differently, because as humans, we're biased towards numbers in this way. And it's the same kind of reason why we price goods at $4.99 rather than $5.
But in some regions, there's still pushback against the possibility of tighter restrictions like those in Toronto and Ottawa.
In Halton, we have never had a case generated in any of our cafes or restaurants or patios. And as long as that is true, I think they should be allowed to stay open.
Ontario's health ministry says today's high number could be thanks to Thanksgiving. For epidemiologists, combined with numbers in nursing homes and hospitals, it paints a bleak picture.
We have a growing epidemic in the province, and there's not really at this point any indication that we're plateauing.
Epidemiologists say this coming week will be very telling in Ontario. The province should be able to determine whether those targeted restrictions put in place 2 weeks ago help bring numbers down. Angelina King, CBC News, Toronto.